Thank you very much. While COVID-19 is a disease that affects really everyone, we heard from our former speakers that we're all at risk. It has a worse effect on our older population, members of the aging population. And certainly also we have seen persons with pre-existing conditions. That term, there are a lot of phrases and terms we are learning as this COVID-19 goes forward. We hear about pre-existing conditions. And so today, ladies and gentlemen, this morning, I'm very happy to introduce one of my distinguished colleagues, Professor Denise Eldemire-Shearer, who is going to bring insights to us on this issue of the impact of COVID-19 on the older population, on seniors, and that's almost all of us now. I think I will qualify in that group. So I'm very eager to hear what she has to say. And also on the issue of pre-existing conditions. Professor Eldemire-Shearer is well known in the region at the University of the West Indies. She is Professor of Public Health, Aging and Public Health. She's also the Director of the Mona Aging and Wellness Center and a former head of the Department of Community Health and Psychiatry. And she wears many hats. It will take the whole morning for me to give all of the full introduction for this distinguished lady. But certainly, ladies and gentlemen, it's my pleasure to welcome to the podium our Professor Denise Eldemire-Shearer to speak on protecting the vulnerable seniors and the pre-existing conditions. Professor Shearer.
Thank you very much, Dr. Paul. Let me add my word of congratulations to you, to Prof. Christie, for pulling this together and, of course, for including the older persons in it. You mentioned the issue around seniors. Now, seniors are only 12%, 13% of the population across the Caribbean. However, we are taking our messages from what we have seen happen in particularly China and Italy, where the information is available from. And if the current slide speaks to that, and it tells its own story, in that you look at the death rate in the 80-year-old versus the 50 to 59, and you see the dramatic increase in that older age group, 80 and over. There has been emphasis more recently on the 70 and over, and with just cause, because as you can see, that's 8% in that age group, 70 to 79, that was kind of getting buried. Hence, whereas we started off talking about over 80, and you will notice that the initial regulations here or directions actually said 75, and in the government's last go round of regulations, it changed to 70, and there is scientific evidence for that. They speak about pre-existing conditions, we speak about comorbidities. Again, we had started off talking about diabetes and hypertension, which are still very critical, both of them, as you can see from this slide, being 9.2 and 8.4. But you will remember that there was a case here in Jamaica that they wondered if it was COVID or heart disease. And we are now finding, and this is WHO CDC information, cardiovascular disease is in fact the comorbidity most associated with death rates at 13.2% and is significantly higher than the other three individually. And therefore the issue around MIs, etc. is very important. Raises an important point that I want to make on this slide. We have to be very careful about the focus on COVID-19 when it comes to older people. Because with the high rate of comorbidities, we are still seeing the heart attacks, we are still seeing the illnesses that we see in the older person, and we have to be sure that they don't get buried under the COVID-19 initiatives. So COVID-19 is killing 13.4% of patients over 80, compared to only 1.25% in their 50s and 0.3% in the 40s. Therefore, this speaks to the importance of trying to protect. And we now know something we didn't know 4 weeks ago, and as everybody says, this is very evolving. As we get more and more cases, unfortunately, we get more and more information. The sharp divide is at age 70. It's 4% of people in the 60s, doubling for the 70s. So we begin to see that it's 70 and over where we need to focus. And I found the next one, got it yesterday, interesting. In Italy, of the persons dying, 83% of them were over 60. So there's no doubt about it. So why are older people so vulnerable? Aging in itself causes an increased risk, and I'll show you why, than the earlier years. And they're not able to fight the virus as well, because the older immune systems are weaker, the wear and tear of time. What is happening is that each time your body has to fight something, it takes its toll on the immune system, coupled with the aging changes of less cells, etc. And therefore, by the time you get to 70 and 80, the system is simply not as responsive as it was before. It also, aging itself, slows down the body's responses. To the reaction time actually decreases. That's wrong. So, sorry, increases is correct. So you take that much longer. Just think of somebody that you are speaking to and the pause before they answer you. That takes place throughout the body. So when you speak to the immune system and you say, I'm on board, I'm a virus, it takes a while for the immune system to respond. And thirdly, the low-grade inflammation that many older people have constantly due to arthritis, and we have, 42% that report arthritis, that dulls the ability to respond. It's a bit like, you're constantly, the analogy that was given is, something's buzzing in the air. Eventually you stop hearing it. Somebody coming into the room hears it. Well, your system is no different. So how do older persons and the wider society, including family and friends, and here we say governments as well, protect older persons? There's really only one option: don't get it. That's the best option for older people. Part of the challenge is, how do we get older people to understand you simply cannot get this thing or you're going to pay the price? So we need to protect older people. How do we protect older people? We start with all of the guidelines on sanitizing and washing hands, and as has been distributed. Sometimes challenging, especially in communities where there is no water. And I will mention the social distancing and what happens in high density communities. So you follow all of those guidelines, regardless of whether you're staying at home or not, regardless whether you're avoiding all contact. You still have to do the sanitizing. You still have to cough into the tissue and throw away the tissue. Now, we know a lot of older people use a rag and use a towel. That does not work during COVID, because you're going to reuse that rag and you are going to reinfect. So it's about tissues, paper towel. I know it's a cost factor, but it's a cost factor that might save your life. So older people do this by staying home and avoiding close contact. I don't like the term social distancing, because social distancing in older people leads to social isolation. And therefore we prefer physical distancing for older people to get across the point that yes, you need some social interaction. And unfortunately, this does include family and friends. So the grandchild climbing all over you has to be from a distance. The grandchild can come into the room, but you and your children are going to have to learn to communicate from at least 6 foot apart. It's not ageism, it's not discrimination. I keep hearing that it's a penalty. Some say that this is just too much. But honestly, it's probably one of the first times that so many people have wanted to protect our older people so well. And we really need to take it as a blessing and say that we are at least being recognized as an important group. So it's not, it's care, it's love. So social isolation is a real concern for older people. Older people are already combating loneliness. One little interaction is to go to church. One only has to look at a churchyard after the service is finished and people are hanging around for an hour or two talking. Going to the supermarket, as one lady told us on the radio the other day, and she was, 85? Nobody can pick my meat for me. Nobody knows whether the pink is the right pink or not. We suggested to that lady that she have her son, who is doing her shopping, send her the picture. She does have a smartphone. So we suggested he could send her 4 or 5 pictures. She could tell him which one. To which she said, but I haven't touched it. So it's really about behavior change, and it's really about adjusting your life, bearing in mind you want life. So you don't want to put yourself in harm's way. Also, interaction with people for older people is all about self-worth. It's about feeling wanted. It's about feeling needed. That caring for the grandchildren. So many of our older people are really missing the school pickup, because that's when they interacted, that's when they felt important, when somebody would say, please pick up Johnny at school. And therefore, as we look to the social isolation, we need to find ways that older people can still consider themselves important and worthwhile. It means no hugging. No hugging does not mean no contact. And I think that's an important message. Communication and staying in touch is therefore key. And how do you do this? And here families have a key role, because we've gotten used to saying, well, okay, 80% of our older people are fine. They're physically and mentally well. And that comes from the 2012 study of older people. We actually only have 8% dependent. So most older people have gotten used to making life for themselves. And we're now taking that away from them. So we need to make the suggestions as to what else. Church is a big thing. So find church on radio and TV. They may not, and this is family again, have a critical role. So family is going to have to step into this gap. Family, of course, here does not mean biological only. Many of our older person has the person next door, the neighbor next door, who is the real family, the 24-hour family. So family here is your community family, your church family. Someone can come, yes, they can come, because if they sanitize and they put on their gloves, they can find out where on which channel, because most of us with 700 channels haven't a clue where to go. So one of the gifts that you can give an older person is to go and find their church service for them and show them which channel and how to get there. Mark it. Where on radio? We have so many radio stations now. The younger people can find out which church service is going on, who is doing what. Is it Reverend Blair? Is it somebody else? Who is the sermon for Sunday? And I warn you, older people do not think it's church without singing. And they say they have to hear the sound. So you have to get a real church service. One of the keys to successful aging is having a routine. Now, most older persons' routine has been dislocated by this social isolation. They are used to going to the supermarket on a Thursday. They're used to going to church on a Sunday. They're used to going to the pharmacy. By the way, pharmacy and doctor is an outing. It's not just, we're saying get a relative to pick up. We are removing an hour of social interaction. So they need to have a routine. So it's for a family member to sit and figure out what is the routine for the next 4 to 6 weeks, and a routine which has some interaction. Maybe it's doing homework via the telephone with a grandchild, and have a plan. A plan for this routine, but also, most importantly, a plan if you get sick. What is the plan? Everybody is being told stay at home. But an older person needs to discuss with somebody. We had a case yesterday where an older person, diabetic, hypertensive, couldn't get up. So we were talking about it. It turns out this morning the person does have to go to hospital. The glucose monitor was not working. So whereas the wife thought it was 48, it was 480. So that you have to be available. Healthcare has to be available, and a temperature of 102 in the axilla, and they don't have COVID. They haven't been out of the room. So the thing is that you have to have a plan. Who will you call? Don't think I'm old, there's no room for me here. Tell somebody if you don't feel well. Equally, reach out to family and friends to discuss your fears. Information is power. A lot of people are hearing about COVID. A lot are watching the television programs, and they're not sure about it. Discuss it. Share ideas. There is an important group of people. There are about 40 to 50,000 of them, and a group that have real issues when it comes to COVID. They have difficulty understanding all this information and facts. What they know is that their life has turned upside down. They used to walk outside, suddenly you're telling them to stay at home. One patient that I have has very agitated because her daughter is at home. If her daughter at home means her daughter lost her job. Her daughter at home does not mean that she's asthmatic and has to be at home. She's lost her job. And she, the mother, is now a burden because with no money, how is she going to look after her? She does not understand COVID. So they're going to have difficulty. They may even have difficulty remembering and understanding the safeguarding procedures. One lady wanted to know why she must wash her hands. Are you trying to tell me I'm dirty? You don't tell me to wash my hands before. And why do you have on a mask? Are you scorning me? That's the world of somebody with dementia. So let us remember these people. They're certainly going to ignore the warnings. They're not going to self-quarantine and they're not going to isolate. And families are going to get very frustrated because you're telling this person to stay inside and they're going outside. And then there are the caregiver issues. There are many caregivers today who cannot come out of St. Catherine. There are many caregivers that are coming out of areas and the family wants to know how to test them because they're coming out. I was talking to one who's coming from Spanish Town. So we have said do temperatures because they can't get tested. The mother in this case has a peg tube. So she is at risk. Can the caregiver come? Persons in the rural areas have a benefit here because rural areas, even with crowded houses, the caregiver can usually stay in. And then there's the possible clinical issues. Is it confusion of dementia or is it confusion of fever? Remember, older people don't get fevers, they get confused. Close family members know the different types of confusion. Trust me on that one. They know, they have been through this for years. Many of them know the difference between the confusion of the dementia and the confusion because the sugar is too high. They know the confusion of a fever, of an infection. Listen to family members. Do not get caught up in the pressure of COVID and lose an older person because of not listening and not checking them. The delirium of hypoxia can present very similar to dementia. Which is it? Is there COVID or is there not? We are saying stay at home. We are saying stay away from people. But we also now know that a large number of persons who are asymptomatic can spread the disease. So therefore, we need to protect our older people, even those that are at home. And memory issues, so they can't give you a history. They don't know where they went. And this is all came out in Lancet this month. So that is how some thoughts on protecting our older people so they can live to see tomorrow. Thank you.
Thanks very much, Professor Eldemire-Shearer, for, wow, I was just, I don't know if it's breathless, but I was taken up by your presentation as you sort of unravel the social fabric of COVID-19 in the context of the aging population. I think, ladies and gentlemen, it was a kind of reality check for us, some really, really pertinent issues that face us every day. I think I want to ask Prof a question, and we've seen in the news in some settings that, and based on your report there, the nursing homes in all parts of the world, not only the Caribbean, we have a large number of nursing home settings set up in different levels and different set of technology and so. But it's a place where we find a lot of our seniors living and having a community life. What can we do to reduce risk in nursing homes? And how do we, some people say, should I put my mommy in a nursing home at this time? Is she safer there? So could you say something about that, Professor Shearer?
Thank you very much, Dean Paul. I knew there was a second group that I was to put up there with the dementia, the nursing homes. Very important and very concerning. And there are two issues to the nursing home issue. We're also saying families shouldn't visit. So an older person, even not necessarily with dementia, but doesn't know why you're not coming. You will have seen that some of the nursing homes in America have allowed you to look through the window and to have conversations. But most of the nursing homes that I have been to here, both public and private, are kind of closed in. There's no sort of outside window. But thinking on my feet, one of the things that could be done for some of them is many of them do have verandas. So for well older people, you could bring them to the veranda and socially distance. So you could, exactly. You have to be very, very stringent with the staff. Temperatures need to be done going in every morning and at shift changes. They have to wear masks, and they have to use gloves. So it means that we have to think about PPE for local government staff, for the public infirmaries, and everybody knows that they're a special interest area, as well as the nursing homes. So, and these fall not only under the Ministry of Health, because homes for the elderly are not nursing homes and are governed by the local government regulations, because they're not sick. The washing of hands is critical. Not every nursing home has a basin in every room. And therefore the issue of making sure that every bed has a bottle of sanitizer beside it. And of course training of the staff. And I think we just have to, there's also a problem with the homes, both public and private now, with all of the various lockdowns. Nutrition is critical. One of the most important things about the immune system is that you want to support it. Nutrition supports it, exercise supports it. But on lockdown, you can't do exercise. They're not getting a lot of fruits and vegetables at the moment because they can't come in from the various places. So you want to look at that. But I think the most important thing is the staff. And the sanitizing is important, but also doing the temperature is important. And reassuring them. No, I would not put anybody new in a nursing home at this point of time. Not only because of COVID, but moving to a nursing home is a traumatic activity for an older person. So you don't want to have two traumas at the same time. So hold on and wait.
Thanks very much, Professor Eldemire-Shearer. I think as we thank Prof, one of the things that the hosting of this conference now from the Faculty of Medical Sciences, our UWI campus in Jamaica, is, in addition to sharing information, to bring a sense of hope and to put some positive support and guidance for our population. And I think this presentation has brought what I would call a kind of collective empathy for the care of our seniors at this time. And certainly we see, I take from Prof's presentation, we all have a role to play, family, caregivers, government, public, private sector, as we move forward. So once again, thanks very much, Professor Eldemire-Shearer. Excellent presentation. And we'll move on to our next speaker on our COVID-19 pandemic conference.